Welcome to the TAF Hub. This is a brand new show brought to you by TAF Africa Global to educate you on real estate business and all the information you need to know about real estate.
After 45 years of construction and real estate development in 8 African countries, it is time to share my experience, and it can only be done in the TAF Hub. We will be inviting experts who will give you facts and the right regulations on real estate development.
Join us every week on our social media platforms for an exciting show. You can also watch us on JRTS TV every Sunday at 8:30 p.m. Welcome back on the TAF Hub. My name is Mariama Kuli, and this is a continuation with Dr. Ismail Badjie of Innovarx Global Health. And from the first episode, if you watch, we did talk a lot about, his business, why he came back to Gambia, and of course, the role of Innovarx when it comes to healthcare providing to all Gambians, especially the wellness on wheel, which is very important. And of course, my favorite service that they are providing, reaching out to all Gambians wherever they are, no matter how far the destination is. Welcome back, Mr. Njai, on the TAF Hub.
Thank you very much, Mariama, and welcome back, Doctor. And let me give you a quick story about doctors.
Yes.
There's an old man, who anytime you go and say that somebody is a doctor, he will ask you, which doctor? So you'll say, well, he had a PhD in history. He says, he's not a doctor, he's not a doctor. He says doctor, not doctor for medicine. So you are a real doctor. I'm not looking down on the other doctors, but these days you even have honorary doctors.
Well, we have
a lot of them, not doctors. But this is a real doctor, a doctor that will fix our health system. So welcome back, doctor.
Thank you.
Yeah.
Now, from the last episode, we were talking about technology and how advanced it is, especially using drones to provide medication. Let's talk more about that, and especially for Gambia. Do you think this is going to be possible in this country?
Absolutely. And I use the example of how the Google Plus Coast address system in the Gambia that's ongoing, how that small commitment and change is affecting a business like ours. And I'll give you an example. So right now, if you had a headache and you needed headache medicine, you went to igh.gm, you order some medication that What's Your Wellness on Wheels will deliver to your home. A couple of years ago, our delivery drivers had to call you and say, where are you? You're next to which store, which big tree? Okay, so they navigate to the big tree, stop, call again. Okay, where do I go from here? So the small change in terms of just one placard in somebody's home. Now our logistics team just asks you, what's your Google Plus code? And it gives them the coordinates where Google tells the driver directly where to go, so the process is way more efficient. So now that we're geo-mapping houses where people live, it's a perfect ground for drone technology because it's the same system. You have an address, it gives you a coordinate. We tell you, okay, this medication needs to go to this compound. We put the coordinates in, the drone deploys, and you could be sitting in your porch, and then you have your monthly medication just land right in front of you.
Wow.
It sounds futuristic, but it's happening.
It's here.
It's here,
Yeah.
right? It's here. But once again, there has to be commitment and conversations on the top layer, and then companies will just it'll be more efficient. And what does that do? Less cars on the road, less traffic. It's safer, because my Wellness on Wheels drivers, if you see them all the time, they have all their gears, protective gears. So you're minimizing the risk from a human standpoint because you don't have motorcycles on the road. Drones, the airspace is open, so it's more efficient. And it's more critical. Traffic doesn't impact how fast you get care, right? Because once it deploys, and companies are doing it for products and services, you just know, okay, a drone is about to land in my compound, in my porch. It lands, it leaves the packet, and then you walk up to your front porch and you go. So think about that for a grandmother who has diabetes, where every single month they know the first of the month at 2 p.m., my compound, there's going to be a drone that lands to bring my medications. that grandmother will never have to go to a pharmacy again.
Yep. But I just want to buttress the Google address system.
Yes.
Because it's almost everywhere within the peri-urban area.
Yes.
But I don't think everybody has noticed this.
No.
But I think on this platform, please, if you are living anywhere within Banjul, Serekunda area, I think Banjul they've done everywhere.
It's done everywhere.
And Serekunda also quite a majority of homes have been done. Please just go out and at your entrance, at your gate, you will find a white a PVC map with blue letters and figures there. That's your address. All you need to do is anybody who's coming to you now, just you can take a picture and just send that on WhatsApp or a location map, or just quote those figures, that identification there. That's your address. And so what happens is whoever is coming there, if you go to maps, just key in that address and then take directions. It will actually give you the direction even by voice. And also give you the time and the best route that you can take, the shortest route. So these are the things that we need to be aware.
I think the team needs to pay you for this, because I did reach out to them for an interview to explain how this works, because people have it on their gates outside their homes and they don't know how it works.
Yeah.
And now here's Mr. Njai giving that brief explanation.
It's revolutionary.
Yeah.
It's revolutionary. And I think even in terms from a real estate development, these are the minor things where, and that's why the country develops together. Small innovations in one sector have a trickle-down effect on another sector, which is why we can only focus on. So just that small improvement now, it's made logistics in the Gambia more easy. Service will go up, because going back to what he says, if our drivers know that, okay, it's going to be 45 minutes to get to Mariama's house, we are communicating to you via text, okay, your order is on the way, expected in 45 minutes, because the driver knows certainly that this is the route I have to take to get there. It's just revolutionary.
Doctor, you know, this is something I use every day now. And I just want to share this on this platform because quite a number of people watch us. You know, when I go to Banjul from Brufut, every time I do what I do, I go into the app and do maps that I'm going to the quadrangle in Banjul. You know, quadrangle in Banjul. Then it shows me the shortest route. I tell my driver all the time, oh, don't go to traffic lights because there's traffic there already. Let's go through Manjai. Some days I go through, I do the opposite. And my driver always asks, how do you know? So I tell him, you use this application. It will tell you where there is traffic. And it gives me the time. So if I have an appointment for a certain time, I'll use the application and it will tell me exactly when I will get there. Plus, minus maybe 5 minutes or so. So it is there available. And you know the best part of it? Me, I love my pidgin English. And there's an app that goes you pidgin. It speaks, in pidgin.
Yeah.
Or you approach this place now, you know. And this is what technology has done. And I'm sure very soon maybe you can have, you know, a Wolof in it because there's Hausa. You know, there are other common languages. So please, let's embrace technology. It's already here. It's not the feature. So the more we embrace it, the better for all our lives.
And the voice, don't underestimate it, because the voice commands for our Wellness on Wheels drivers, they can't have their phone.
Of course.
So they have an earpiece on, and once they navigate it, it's giving them instructions where they're not distracted. So they'll tell me in about 50 meters, turn right. So just that small feature, it's just revolutionary what's happening in terms of that space.
That's right. But what are your strongest leadership qualities and how do you apply them to your team?
Honesty. I have this concept of maps and mirrors that I use from a leadership standpoint. Maps meaning always knowing where you're going. We were just talking about navigation, right? That is a principle that I've always applied in my life in terms of, even if a map could be Uncle TAF from a mentor or a role model. That's a map, what he's done with TAF Africa Global. Or a map could be a goal. This is a company I want to build, which is great. You have dreams, you have goals, you communicate it clearly, but then you have to always have a mirror in your back pocket. The mirror is the accountability piece from a leadership standpoint. Am I putting in the work? Have I truly committed to the apprenticeship before entrepreneurship? Do I really have the discipline in terms of studying outside my field? range. Most people, I have a doctor of pharmacy. I did not go to school for business. I did not go to school for technology. I did not go to school for leadership. But how am I applying myself and learning to make sure I am the best version of myself to deliver results? And I think that's always been my leadership strategy. So even most people that work for Innovarx will tell you, he'll always tell you the map where we're going, but best believe he's always going to bring a mirror to the conversation. And I think us as Gambians, often we have maps all the time, people we look up to, things we want to do, but very seldom do we reflect to see, am I signing a contract with myself to make sure I'm honest with what I'm doing? Am I capable enough? If not, I shouldn't do the job. If I'm unprepared, let the opportunity go to somebody else who's more prepared. So that's always been my philosophy from a leadership standpoint. Have a map, but also have a mirror. Because I think it just allows you to grow in a more honest way. And from a leadership standpoint, people that you work with and work for will always know that your intentions are just designed for there to be clarity and honesty. And that's just liberating as well, too. So I have a lot of people that I call my map in one aspect. But the mirror is a very powerful tool.
But do you think being a good leader within the healthcare system also influenced the performance of the doctors and the nurses who are working within that field? Because every time I walk into Innovarx, you know, the people that are working there, they're very welcoming, they're very patient, you know, though the workload is stressful and everything, but still, you know, they treat you like this is your home, feel free, you're welcome. Do you think that also has something to do with your leadership role? Because I see you involve your staff a lot in so many things that you do. You know, sometimes they go on media platforms without you, and they're able to deliver about your services. Does that have any influence?
100%. I think whenever you're in the business of providing services, right, you're in the business of selling human experiences. Most people remember how you made them feel. So from a leadership standpoint, one of the features about my business model with clinicians, most business models, they pay you based on how many patients did you see today? 10 patients, I'll pay you $100. So I'm paying you $10 per patient. As a clinician, you're focused on, let me get to 10 fast enough. My philosophy is, I'm going to pay you by the hour. I don't care if Mr. Njai needs 1 hour to leave feeling like his dignity is restored. You take care of Mr. Njai for 1 hour. Right? So now the commitment is to the experience and the quality of the work. So from a leadership standpoint, I'm going to hold you accountable for how did you make the 5 patients that you saw comfortable and satisfied with the experience versus telling you, why did you only see 5 patients when you should be seeing 10 patients? And all of that is just communicating and communicating intent. What are you trying to create from a leadership standpoint? And you realize now most of our doctors, if you notice the interaction with our nurses, they never feel like they're in a rush because they know that the moment you walk into that experience, your concerns, your questions, the quality of your answers is the only thing they are being evaluated on. And I think that itself is a shift in our sector because they'll tell you, why are you paying them by the hour? What if you only have 2 patients? No. They have to understand what healthcare is all about. And that's why they're able to go into people's homes. And if a grandmother who's there who hasn't had any personal interaction, her blood pressure is fine, but she just wants to tell you about her day, you don't have to rush back. That's what she values, that human experience. And that's why a lot of people that have our care plans, sometimes wellness is all about how you feel. It's not about taking medication. Sometimes our nutritionists, we have a nutritionist at our facility. She'll go to the homes and just tell them, okay, what did you go to the market to buy? Let's go in your refrigerator, let's talk about it, the quality of the experience. And that from a leadership standpoint, I think is very important for them to understand that.
I'm glad that we spoke about leadership. As you know, I am very concerned about leadership. And Wode Maya, I'm sure you know Wode Maya, the YouTuber, Africa's biggest YouTuber.
Your son.
Yeah,
Yes.
my
His
adopted
adopted
son.
son,
I'm sorry if he watches this episode. Kudos to Wode Maya. And he asked once that if I had one thing to change in Africa, what would that be? And my response was leadership. And when I say leadership is not synonymous to politics. Because most people, when you talk about leadership, they think about the president, the ministers, those in government. But really, my issue, my point is not directed on only political leaders. All of us are leaders in our own field. And I am happy you've addressed this. That if all of us as leaders have got the right values to lead, then the followers will perform. Absolutely. And I'm glad you're doing this. So let me just ask you quickly, as a leader and medical practitioner, what challenges do you face and how do you get around them? Because, I mean, you will face challenges. So share with us what challenges that exist and how do you go around them?
Yeah, so I think Africa in general, anytime you talk about healthcare and challenges, there's an issue of scarcity, lack of X, lack of medications, lack of hospital beds, lack of that. But I think the biggest level of scarcity or challenge is actually a lack of awareness or understanding from the people. And it goes back to the mirror. An average Gambian will tell you everything that's wrong with the health system. But you ask them, this week, did you walk for 30 minutes on the beach? They're like, what do you mean? I'm sitting in my office, I have AC. I'm eating Banachin every single day. Yeah. You ask them, when was the last time you checked their blood pressure, right? They're like, what blood pressure? Yeah. I'm fine, I wake up every day, I'm fine, right? So the biggest challenge that we face is changing the mindset of people to understand that your relationship with healthcare should not be in the moment of crisis, which is the typical Gambian experience. If you think about it, how many Gambians on a day-to-day are perfectly fine, just walk in and say, you know what, I want to check my blood pressure today. I want to check my blood sugar today, right? I want to go see a nutritionist because I'm having issues with too much, sugar. They don't. And that's a significant challenge. So now by the time they arrive to most of the medical professionals, which there's a joke, anybody who wears a white coat will tell you sooner or later you'll have to come see us. You just decide when. But sooner or later, you'll have to go see us. And especially with men. They say men spend all their lives chasing money to get old and spend all their money chasing their health because they've ignored it. So I think the significance of the challenges is changing the mindset of people. And that's where the advocacy and championing health comes with, because then you minimize the burden of healthcare. Because now preventative care is cheaper than emergency care. It's cheaper for you to check your blood pressure every single day and your blood sugar to make sure you're not diabetic or hypertensive than getting a kidney transplant or needing dialysis. So we'll cry more about lack of dialysis units when the average Gambian needs to know what their blood pressure is. We should be championing. That's why every time even Uncle TAF is on the beach walking, it's like people should be doing that because there's an investment and you're helping bring the burden. Because Gambia has never had a time where our health system, for example, lack challenges. It'll never be that way. But Gambia, majority of the population is young, right? So why are we trying to build 100 hospitals when Gambia in the next 50 years, if we democratize access to preventative care, make sure people take ownership of their health, we'll need less hospital beds. We have enough hospitals in the Gambia right now to take care of our population. What we need to do is avoid the inflow of people who have neglected their health until it's a time of crisis and the system can't handle it. We don't have enough doctors. That's the challenge. There's 10,000 Gambians to one doctor. But going back to telemedicine, that means one doctor could be in this studio and seeing 10,000 patients from all over the Gambia. Technology, right? So where challenges exist, there's solutions. But I think that comes along with it. And I think from a regulatory standpoint, there's always going to be challenges from a healthcare provider standpoint. I think the biggest challenge is just the mindset, the awareness, and making people understand healthcare from a holistic perspective and not emergency care as well too. That's very significant.
Yeah, that's good. Let me give examples. As you know, I am a health advocate.
Yes, you are.
Because I always share my experience,
Absolutely.
as an individual, what I've gone through. And since we have you here as a doctor, I think it's good to share my experience that I am a cancer survivor. I had prostate cancer when I was 50 or 51. Today I'm 65. And I had to do, an advanced prostatectomy. It was done on me. So I had to go through a surgery. And the surgery took 3 hours. So it was really, life-threatening. So I have had this done. And from then, I have advocated for men to regularly check on their PSA.
Yes.
You know, because Africans or black people, after the age of these days, even 40, you know, can have an enlarged prostate.
Yeah.
So I have gone through this, and here I am today, thank God, you know, 14 years after, still up and running, being the youth man who I am. The second one is also about blood pressure. I have been hypertensive for 25 years. I was diagnosed having high blood pressure when I was 40, and it was through regular check. Thanks to Standard Chartered Bank, I borrowed so much money from them that they had asked me to take what they call a keyman insurance. And the way they put it to me was that, look, okay, we know we have all your properties, you know, as a security, but to save, you know, your kids for inheritance, if you were to drop dead today, we should be able to claim from an insurance rather than take your properties and sell them. And for that reason, you have to go and do a health check. Then you have an insurance on you, which is called a keyman insurance. So when I did my health check, my doctors discovered that I was on the borderline, but I was hypertensive because it was hereditary. Now, let me give an example what happened to me about 3 or 4 years ago. Because since then, I move around with my blood pressure machine. Where you just put, I don't even use the one with the cuff. One with the wrist, very small, as small as this cup, or even smaller, that I always carry these days with my bag. And I have the habit of checking my blood pressure at least once a day. So I was in South Africa at Melrose Arch in a hotel, and a regular check. There was nothing that I felt, you know, unusual or abnormal. So I just checked, and I noticed that my blood pressure was high. So I rested for a while. After 5 minutes, I checked again, because normally, for one reason or the other, I double checked again, but it was still going up. So I called the reception and said, look, I want a doctor to come and check my blood pressure. So they called SOS Medicine. They came in, and they checked, and they were alarmed. Well, they said, no, we cannot just leave you here. We have to bring in the ambulance, take you on an ambulance, and take you to the hospital. So they took me to the hospital, and my blood pressure was really high. I have never seen my blood pressure that high. Why that happened, I don't know. But lesson to learn is, okay, they kept me there overnight and controlled my blood pressure, changed a bit of my medication to bring it down. But it is very likely that if I had gone to bed at that time, I could have had a stroke.
You would have had a stroke, yeah.
That's what it means. Quite a number of people, we see this happen all the time. Oh, he was here talking to us last night, and now that is it, he's had a stroke or he's dead. Please, just like what doctor said, preventive medicine. So quite a number of individuals now in this country at a certain age are either hypertensive or diabetic. So let us please do the primary health care, they call it.
40, you're even lucky. I got diagnosed with hypertension at 28.
Wow.
I take medication every single morning for high blood pressure. Because once again, my grandmother died at 56 from diabetes and hypertension. My mother has diabetes and hypertension. 28 years old, I got diagnosed with hypertension because I understand the disease. That's why people that know me, I'm active the way I am. You know, I'm strict about my nutrition because I know these were the cards that God dealt me from a hereditary standpoint. And black people have a higher disposition to these conditions than any race in the world. And from a what's your number, the free screening that we're doing in the Gambia, 4 out of 10 Gambians that we screen, free of charge for hypertension, are hypertensive.
Wow.
And majority of them don't know, meaning they're unregulated, they're not on medications. So going back to what he says, they're walking ticking time bombs. You just wake up, you have a stroke. And if you live in Basse, you have a stroke, and Basse doesn't have the equipment to take care of you. By the time you get to Edward Francis or Carnifing Hospital, it's too late.
Now, this will bring me to the question where most of the time we don't have home first aid, let's say first aid in the house for our elderly or even for ourselves. You know, what to do when situations like this happen. We know so many people had stroke and people don't know what to do at that instant while they're having the attack or how to care for them after that as well. Does Innovarx have any plans in the future to train people on first aid for families?
No, I think especially when it comes to non-communicable diseases, which is the bundle you put them in, diseases that sitting next to you, I can't give you my hypertension, right? If I was diabetic sitting next to you, I can't give you diabetes, right? So that training has to start at the grassroots level so that they understand that, okay, what you want to avoid, as Uncle Taf said, is a stroke. But how you do it is you need to keep your blood pressures under this range, meaning the moment it gets above this range, there's nothing you could do or change in your lifestyle to bring it down without medications, the right medications, right? So you understand, it's like diabetic amputations. Amputations are only happening in the Gambia. The Western world, for you to hear a diabetic that got their foot amputated, it's seldom. Because you understand that once you have this condition, you're going to live with it for the rest of your life. If you do not manage it, science is one of those things where it's predictive. If somebody whose hypertension is not being managed properly, you're probably going to end up with a stroke. Or your kidneys are going to start shutting down. The same way a diabetes, your nerves are going to start being affected. Your eyes are going to start being affected. If you have a wound, it would not heal. So for people to have that basic understanding is where a lot of the effort needs to be in terms of communicating across all literacy levels, across all languages, and making preventative care free of charge and accessible. And accessible means if you work in a village community, we should have clinicians who come up to that community every Tuesday to check everybody's blood pressure free of charge. So the 2-3 people that are high hypertension, you do an intervention. Bring down the cost of medications to make it more accessible. So if you need one medication a month to take care of your blood pressure, you should have access to it. And I think the government is thinking about national health insurance and things of that nature. I hope before we do things like infrastructure, let's build the foundation of awareness. And that goes with first aid, just knowing the complications and implications of not being proactive about our health as well too. And that's why the company is so passionate about pushing advocacy and, removing all the barriers to care.
Now, if you could go back in time to say 10 years ago, what advice would you give your younger self, doctor?
Now, I think 10 years ago, I was still in school. If you go to become a doctor of any of the sciences, you're in school till you're 28, 29. So I think at that point, what I'm doing now wasn't part of the picture. Entrepreneurship was not part of my game plan whatsoever. My parents will tell you, my mom, I'm the child who they least expected to go into business. Because normally, they expect the females to take over the business as well too. So this wasn't part of my plan at that time. The path was like, okay, have a career as a successful, doctor of pharmacy, working in the communities, good life, and you come back to Gambia to visit as well too. And I firmly believe that most of the times, every single experience that I've had in my life has happened for a reason, like as in it was preparing me for this moment. So I'm not a believer in going back to see I would change X, Y, and Z, because if it's a negative experience, I learned from it. If it's a positive experience, I didn't let it get to my head, so I knew the destination was longer. So I've just kind of believed that everything that's happened up until this point, the people that I've met in my life, the people that have supported me have just been there for a reason. So in terms of changing much, no.
Yeah. You know what I would like to do? I would like to ask that question myself. Because there's a generation gap here. But I would not say 10 years ago, but if I were your age, and I will come up with the response. And the response would be, make the world your home. Leveraging on technology. Remembering that you can live in the Gambia, but yet still leverage on technology to exploit the world. So if I were your age, which if I calculate right, it's about 35, oh my God, I will make the world my home. So all you young ones, please, you have a tool in front, like right in your fingertips. And that is using technology to leverage on exploiting the world. Yeah.
Now we'll just wrap up. But before we go, do you have any advice for young people watching this particular show, or just to inspire them?
I think as a young person, let's say an entrepreneur, I think sometimes the space that we're in, we're rushing a lot of young people into feeling like they have to solve all the world's problems in terms of everybody has to be an entrepreneur. But I always remind people apprenticeships happens before entrepreneurship. You cannot rush the process as well too. And sometimes not everybody has to be creating a vision. Sometimes your purpose in life could be aligned with somebody else's vision, and you could be fruitful in doing that. But it's just my experience now, especially in the Gambia, coming back, interacting with a lot of young people. There's not only one way, because most of the times they might see Uncle TAF, but they don't realize Uncle TAF, 40 years ago, the little things that we're building up, like finances, compound interest, the little things. They could see me today and be like, oh, he owns Innovarx, but I've worked in factories in the US. I've been waiters in restaurants. Like I used to have a job in the pharmacy where my only job was packing medications on the shelf, organizing medications from A to Z. So you have to trust the process and know that be patient with your purpose. And that's very, very important as well too. And also understanding something Uncle TAF says, like, it's not time for young people. It's time for people with high moral character. And I heard Uncle TAF said that, especially in Africa, which I used to be of the notion like, it's time for young people to take over Africa. No. Identify what your purpose is and align it with a strong moral character that you can make the world better. Now, if that's a good employee, you do it. If it's a good entrepreneur, you do it. But you have to always have a map and a mirror to be honest with who you are and where you are. And I think that's so important.
Great. I think lesson to learn here, something that I've seen you repeat all the time is map and mirror.
Yes.
Map and mirror. So something to learn new. But as we wrap up, I like what you've just said about apprenticeship. This is something that I re-echo in all my deliveries to young people. And it is best expressed in Wolof. And I will do the translation. In Wolof, they say, Lo donu talubem, do don serignam. Lo donu talubem, do don serignam. Now, what that means in English, that what you have not gone through apprenticeship, you will never be a master of it. So let us learn this. Young people, let them take their time and do their apprenticeship to be a master of the art that they are doing. So Dr. On that note, we want to thank you very much.
Thank you, yes.
The reason why we brought you in here is to inspire those young ones who look up to people like yourselves, to learn about your story. So we thank you so much for sharing your story.
Thank you, guys.
This will not be the last time that we are calling you on a platform like this. We want to bring in people like yourselves. I mean, Gambians who's broken that glass ceiling, who has made a difference. We have seen quite a number of doctors who came in, who went through the journey of setting up hospitals, clinics, and they've done their own bit. You're coming in and making something different, and obviously, I'm sure, learning probably from their mistakes and then moving on. That's the only way we can move a nation, this small country of ours. Everything we do, it's to advocate for better practices so we live in a better country. So on that note, Mariama, we want to thank our viewers and thank our guest, Doctor. And until we see you again, don't forget to follow us on our social media handles. On YouTube, it's Mustafa Njai-TAF. Thank you.